Hi, everybody. We'll just give it a couple minutes and see who's going to arrive for our Facebook Live talking about Pilates and sciatica today. I will let you know there's a bit of a delay on my end, so if you do post a comment, and hi Sheila, and it's delayed my response, please do know that I'm going to be responding to comments and questions at the end. So we'll just work with a little bit of the delay that's happening, and I think all should be good, but it should be an interactive learning experience. So feel free to comment even if you don't get an immediate response. Okay, so let's get started. Let's just talk a little bit about, hi Liz, for those of you currently watching who has worked or is working with someone as a Pilates movement teacher that has sciatica, and whether you've questioned what exercise to give them, whether it's a flexion-based exercise, extension-based, should I stretch them, should I strengthen them? Anybody just chime in. You can thumbs up, or you can comment. I wasn't sure what to give the client, and that's just being really authentic and transparent because we've all been there. And I think one of the reasons why with this particular condition is that sciatica is really actually kind of complex, and it's also not a diagnosis. Yep, got it. Okay, you've had it but not worked with anyone. I got it. Yeah, it really is a symptom, and it's a result of another kind of condition or injury. And I'm going to talk about all the different types of injuries and conditions that can create or cause sciatica. The symptoms can also vary quite a bit. So you can have anything from pain and numbness and tingling to also tightness and weakness that are occurring down the leg. It can occur in the back of the leg, it can occur in the side of the leg, and it can occur in the front of the leg. It can occur just in the thigh. It can also occur down the lower leg, so into the calf or the lower part of the shin. So it's not a straightforward condition by any means, and many times Pilates instructors are not really taught about the different causes of sciatica, and therefore don't really know what exercises are going to be good for that condition because it's dependent on the cause of the condition. So today I want to clear up some of the misunderstandings around sciatica, but also talk a little bit more about the different types of causes of sciatica and the exercises that you could select based off of that. Also, just to introduce myself a bit, my name is Ariel Lehaitre. I'm a physical therapist and Pilates instructor. I've been practicing for a little over 20 years, and I have a Pilates studio in Los Gatos, California, where we focus on rehabilitation and using the Pilates method for that. I'm also a professor in the kinesiology department at West Valley College, where I teach special populations and injuries to Pilates instructors in training there. And I'm also the founder and curator of Clinical Instructor Academy, which is a training and mentorship educational program for Pilates instructors to learn how to work with clients that have injuries. And I'm going to talk a little bit more about Clinical Academy at the end of our talk. So let's go back to sciatica. Sciatica is pain or injuries can cause sciatica. And then the least common is actually the piriformis syndrome, which some of you may have heard about. So that's probably the biggest misconception around sciatica, is that it comes from a tight piriformis muscle. And a lot of times our clients are going to come in thinking that that's the reason they have the sciatica symptoms, when in fact, most of the time, this condition is coming from a problem in the lumbar spine, an injury or condition of your low back. So in reality, 6 to 8% of sciatica cases are from a tight piriformis muscle. It's pretty interesting, actually. So that if that's all you get from this talk, is that addressing the piriformis to work with your clients that have sciatica is not going to necessarily be the correct approach. And I'm going to give you the correct approach. depending on the causes of sciatica, the symptoms that go down the leg, whether that's numbness, tingling, weakness, burning, pain, it will be dependent on lumbar flexion, lumbar extension, sitting or standing. But again, that's going to depend on whether the condition is caused from stenosis, a disc herniation, a hamstring injury. So the cause determines what's going to provoke the symptoms, which helps us determine what exercises to give this client. And because there's so many different causes, there's really no universal one-size-fits-all Pilates program for sciatica. I wish there was. It would make things a lot easier, but there's not. And so let's just talk and review a little bit about first the common mistakes that we make as movement teachers, and then I'm going to go into what to do instead. So mistake number one is, as I mentioned previously, assuming that the sciatica is due to a tight piriformis muscle. Some clients may improve with gluteal release and stretching, but others may actually worsen. And sciatica symptoms that are resulting from a lumbar disc herniation or a lumbar spine stenosis, they're going to require a different exercise approach. Okay, before choosing the exercises, the instructors again need to know what the pain generator is. Okay, stretching the piriformis muscle is not the solution to managing most sciatica symptoms. Mistake number two is focusing solely on the affected leg, either trying to mobilize the affected leg or strengthen the affected leg, specifically the hamstrings or the glutes or the piriformis, without addressing the underlying cause of the sciatica. So in many cases, the source of irritation of this nerve is coming from poor lumbopelvic control, inefficient movement patterns, excessive loading of the low back. So we as movement teachers, as Pilates professionals, need to help improve their trunk stability, their core control, their pelvic alignment, their hip mechanics, and the movement quality, the way that they're moving, not just in therapeutic exercise, but in daily function, to reduce stress to the irritated nerve. And that's going to create more effective long-term relief of the nerve symptoms than stretching and strengthening that leg. Mistake number three is stretching the sciatic nerve when it's too inflamed and irritated. One of the most common mistakes I find is that when a client comes in and says that they feel tight in their hamstrings, that as Pilates teachers, we feel like we need to stretch them. Tight hamstrings are often not short hamstrings. I'm going to say that again. Tight hamstrings are not always short hamstrings. So in many cases of sciatica, the hamstrings feel really tight because the nerve is irritated and it has protective muscle tension, protective muscle guarding. But the muscle themselves, the hamstrings, are not actually tight. And so if we try to aggressively stretch the hamstrings, we most often will irritate the nerve further, will increase its sensitivity, and will worsen the sciatic symptoms. So instead, in working on improving their movement mechanics, like I previously mentioned, restoring their core control, their lumbopelvic mobility and control, this will often automatically and naturally decrease the sensation of tightness down the leg without having to stretch or tension the nerve. Okay, so three big takeaways here is assuming that sciatica is from the piriformis when that's only 6 to 8 of cases. So now you can leave this talk understanding that the majority of sciatica is due to lumbar disc dysfunction, pain, pathology. And so we need to address lumbopelvic control and the lumbar spine in order to improve sciatica. Number two is not focusing on the leg, but focusing on the whole person's body, how they're moving, how they're organized posturally. Yep. How they're using their breath and their core and their hip to move throughout their day and how they're moving in session. And number three is to not try to stretch that nerve too soon. There is a time and a place when sciatic nerve flossing can be done, and that's something I do teach in Clinical Instructor Academy. But I will tell you that I have seen so many times over the years people trying to stretch a tight hamstring muscle and address sciatica in their clients, and they make their client's condition worse. Yeah. Sheila asked, would you do that without load and resistance? That's such a good question. So initially, I tend to keep people unloaded depending on the condition. So exercises that are in supine, side lying, quadruped, really nice unloaded positions where you're teaching them how to stabilize the lumbopelvic area, and then progress them into things like sitting and standing movements, that is great. I hope that answers your question. And I'll definitely make more comments in response to questions toward the end. So let's talk about some exercises that can make sciatica worse, that you can just really, these might be some writer-downers here, okay? So exercises that tension or stretch the sciatic nerve at a certain point during their pain cycle that can make these symptoms worse are exercises like feet in straps, single and double leg stretch, and even exercises like 100 and teaser, where the leg is up at like a 45-degree angle. So anywhere between that 45 and 90-degree angle where there's length through the back of the leg, whether it's supported by a strap or not, can tension the nerve. And when the nerve is really irritable, it can make the sciatica symptoms worse. So anything where the leg is either a single leg straight raise or a double straight leg raise, to a point where I've actually even had physicians who refer to our studio make comments when they refer saying, I do not want my client doing bilateral or single leg straight leg raise positions right now, because they understand that that is commonly given in Pilates classes, and they feel that their client will get worse if given those exercises. So that's where modifications like straps around the thighs with bent knees is going to be more effective, doing 90-90 tabletop type work versus full 100 or teaser. Another exercise or list of exercises that can make sciatica worse when it's due to a lumbar disc herniation is going to be exercises that are flexion based, so round back type exercises, particularly when loaded. So things like roll ups and roll downs, spine stretch, cat variations, and especially exercises like short or long spine inversions, because you're loaded the spine and you are in flexion. So if your client has sciatica due to a lumbar disc herniation or pathology, an injury to their lumbar disc, flexion biased exercises are going to make them worse. Stomach massage, inflection, roll downs, roll ups, any kind of C curve type positioning, particularly in standing and sitting, will likely cause their symptoms to worsen. Examples of exercises that can worsen sciatica when they have the sciatic symptoms due to lumbar stenosis, which is this narrowing of the vertebral foramen where the nerve is exiting. These people, these clients, are sensitive to extension. They're often going to be your older clients that tend to get symptoms down one or both legs when they're in standing or when they're on their belly. So extension biased positions or movements. And exercises that provoke these kind of symptoms in stenosis would be like any kind of swan variation, swing variation, pulling straps, breaststroke. Prone-based work would be off limits for these clients. You would start with them in unloaded positions, eventually progress them to sitting, and then eventually progress them to standing based on how their sciatic symptoms are behaving. Yeah. So all of these exercises, they're not bad exercises. I think what's just important is that you need to understand when and when not to give them, particularly when you're working with clients that have nerve-related symptoms. So in terms of safe progression for your clients that have sciatica, my suggestion would be, rather than emphasizing mobility and flexibility of the spine and the leg especially, think about controlled movement progression and protection and stabilization initially. So what phase one could look like Lateral flexion. Yeah, lateral flexion, that's a great question. In somebody that has stenosis, so your client that's typically 60 and over, that's a large generalization, that has symptoms from extension-based movement, like standing or anything in prone, those clients will also be sensitive to lateral flexion. It doesn't mean you can't do it. Like if you have it isolated to the thoracic spine and you're doing like a modified mermaid in sitting, that could be great. But you're not going to do things that kind of close the vertebrae down, which is what happens in extension, side bending, and end range rotation. Stenosis clients really like flexion because what that does is it opens up the foramen of the vertebrae and gives space for the nerve root. So exercises like pelvic tilts when someone has stenosis with sciatica can oftentimes be very relieving. And I talk more about that in Clinical Academy. Exercises that are good for lumbar stenosis versus a disc herniation versus sciatica. But again, sciatica is a bit complex because it can occur with numerous types of injuries. And that's why I'm so passionate about giving this talk today, is I think a lot of times we've been misinformed or we don't have information about all the different reasons sciatica occurs. So we try to work with it the same way with everybody, which is usually to try to work with the leg and stretch the nerve and the hamstring. And it's really not how we want to address sciatica. So safer progression would be starting with restoring lumbopelvic stability. Work in neutral spine. Avoid symptom provocation. And once the symptoms have started to settle, then you can start to progress to mobilizing the spine and increasing the load. So again, starting in more non-weight bearing positions like supine, quadruped, and sideline, and then progressing to things like sitting and standing. And so examples of exercises that you could give someone in phase 1 on the mat could be your basic fundamentals, like your abdominal breathing, your bent knee fallouts, supine abdominal marches, some mini modified bridge work, quadruped weight shifts, or bird dog type variations. That would be great. In phase 2, you could then start to move toward more spine mobility and lower extremity flexibility. So what that could look like is cat and cow in quadruped, or book openings lying on your side, rotational twists, non-weight bearing. You might also then be able to do like a single kneaded chest stretch or a figure 4 stretch for some rotational mobility of the hip. And then sciatic nerve flossing is what we sometimes do, which is a gentle mobilization of the sciatic nerve and hamstring. And I'm not going to go into extensive detail on that. I do have some videos on our YouTube channel about it. And it is something that we go into in Clinical Academy. But it's definitely not a one-day talk type of topic, but certainly something to be aware of that is done in rehabilitation of sciatic nerve symptoms. And then phase 3 would be progressing to more of your functional movement. This is where we're going to be more upright. We're doing things in sitting and standing, squats and sit to stand type movements, practicing our hip hinge strategy, step-ups or standing work using the springboard or the trap table or the core line, even better, if you have access to that. So again, to kind of summarize, becoming a Pilates instructor, working with someone with sciatica, the first step is gathering as much information about this person's condition as possible. If you have the client's had an MRI, or if you have access to be able to reach out to their medical practitioner, getting information about this person's condition is going to allow you to intentionally program their Pilates exercises more safely. Okay, then you're going to observe how they respond to the movements you're giving them and learn what increases their symptoms and what calms their symptoms. And then you're going to modify your program accordingly. And this is what we consider clinical knowledge and clinical reasoning, right? It's understanding the why, the intention behind what you're giving people, so that you can not just teach safely and not hurt them, but you can actually be therapeutic in your approach. And this is what I'm really passionate about with Clinical Academy, because I feel like there's a gap right now that's occurring in the Pilates education. When you go through the certification training, you learn a lot of exercises and you learn how to teach and observe movement, which is beautiful. But what you don't necessarily get is clinical reasoning skills and the ability to know how to work safely and intentionally with injured clients. And what's happening in our industry is that we're getting more injured clients coming to see us. That's really what's going on. Physicians are referring clients to Pilates. Clients are referring other clients to Pilates. And so what that means as Pilates teachers is that we have to almost up-level our profession. We have to be more educated. We have to understand how to work with clients. What does lumbar disc disease mean? What does sciatica really mean? And that's going to help us to be able to program safe Pilates movements, because we're going to see these clients. We're going to see clients that have total hip replacements, knee replacements, shoulder pathology. And so this is why I've developed what's called Clinical Instructor Academy. And this is a comprehensive mentorship and training program that I've curated for Pilates instructors to work with clients that have the most common injuries or conditions that I think you'll see in the Pilates world. So in this program, you learn more about sciatica. You learn about the most common types of low back injuries. We go over cervical and neck injuries, shoulder tendonitis and frozen shoulder, hip pain and pathology like labral tears, tendonitis, total hip replacements. We go through knee conditions, patellofemoral pain, meniscus tears, and total knee replacements. And then we go through sacroiliac joint dysfunction and pain. So the entire program is about a 6-month continuum. I'm on weekly calls with you, and you're taking the courses online. So it is self-paced, but I am mentoring you the whole way through. And at the end, there's a final examination that you can take to actually receive a clinical Pilates specialist certification, so that you can then say that you've been trained by a physical therapist and Pilates instructor on how to work clinically with these type of injuries. And so you're learning clinical reasoning skills. You're learning what's driving these clients' symptoms and how to choose appropriate exercise progressions and modifications. It's not to become a physical therapist. That's not the goal, but it's really to become a more thoughtful, intentional, skilled Pilates instructor. So if anybody has questions about sciatica or about Clinical Academy, please feel free to either unmute yourself, chime in, or make a comment. It might be a little bit delayed, but I'm going to be here for a few minutes. If you want more information about Clinical Instructor Academy, please also comment. You can comment yes or sciatica, and I can send you some specific information about it. We'll also provide you a link to my most recent book, which is Clinical Pilates for Low Back Pain. And that's just an easy investment on Amazon if you're interested in just getting more information about some of what we talked about today. And I just really appreciate you guys all being here. Thank you. Yeah, okay, so I'm seeing your comment here, Sheila. It says, I wish there was a way to get this with my current certifications while I'm working through my Pilates certification. So, yeah, definitely let us send you some information on it. You can do it simultaneously. So you don't have to be a fully certified Pilates teacher to join in on Clinical Academy. But you do have to have the majority of the training on the equipment. So what we'll go through in the academy is like you'll be given exercise sequences and progressions for different injuries, and that will include mat-based work, reformer, trap table, and chair, and then a little bit on the core line. And it's okay if you don't have access to the core line, but that's the concept, is that you are given protocols, for lack of a better word, but really templates to understand, here's how I would address this injury. This is what kind of work I could do on each piece of apparatus for each type of injury. And so it's actually very complementary to the other Pilates training. There's nothing that's going to be opposing. We're in process of figuring out how to get credits through the national certification program. I'm in the process of doing that whole application process so that you can get credits for our program, for those of you that have taken that test and need the continuing education credits to maintain the certification. NPCP. Did that answer your question? I think it was Sheila. The name of the book again, hi Monica. So I think Christy CP just posted it, and it is called Clinical Pilates for Low Back Pain. And that is available on Amazon. And also Christy's placed the link here in the comments. So hopefully I answered your question, Sheila, about being able, you can go through the Clinical Academy while you're getting your Pilates training. That's fine. And Sheila as well. Yeah, same person. Okay. Yeah, while you're obtaining hours, you can learn about Pilates programming for injuries. That's not a problem. Thanks for all your questions and comments. Okay, so Liz, it looks like you were diagnosed with lumbar stenosis. Got it, which has given you some sciatica. Yeah. Oh, shoot, and your chiropractor says there's not much more she can do. Yeah, so it's about getting movement and training that might be a little bit more flexion-based involved to open up the space where the nerve root is compressed. That's how we address stenosis. Yeah. Oh, yeah, thank you, Sheila. It would be awesome as an NASM too. I'll look into that, yeah. Anybody else have any questions or comment? Good to see you here, Jamie. Liz, are you working with Pilates to help your sciatica yet? There might be a little bit of delay response. Anybody else have questions or comments? Of course, Sheila. Thanks for being here. I really appreciate it. I don't know how much you got to catch, Jamie, but there will be a recording provided. And essentially what I went through is the different kind of basic causes of sciatica. And that part of the challenge, I think, as a Pilates movement teacher and working with clients that have sciatica is not really understanding what the cause of it is, and therefore having difficulty programming the right type of therapeutic movement for them, because there's so many different causes for sciatica. And some clients will respond well to flexion, others will respond well to extension. Others really need more unloaded neutral exercises. So if we can get that information from the client or their medical practitioner, we can be more intentional and safe with the exercises that we program for the clients. Sciatica is most often not due to a tight piriformis. And that's kind of what I feel like is the biggest misconception, is let's just stretch the glute and release the glute and hope that the sciatica goes away. But it's really more about addressing the entire body, the position of the spine, the lumbopelvic control, and organizing their movement patterns to take stress away from the irritated nerve that can cause such a variety of symptoms down the leg, including pain and weakness, numbness, and tingling. Can definitely be a beast of an injury. And so I go into it, it has a whole extensive separate piece in Clinical Instructor Academy. So Please feel free to private message me if you want more information about my book or my certification program or any of the online courses. We're in the process currently of adding more specialized advanced courses for osteoporosis, hypermobilities and autoimmune dysfunction, pelvic floor dysfunction, and post-surgical conditions like spinal fusions. So I'm really trying to create a space that can educate Pilates teachers on these conditions that are walking in the door to see them, because the current trainings just have not been able to provide that information. And it makes sense. I mean, some of them are 10 to 12 months long, right? And that's just to learn the variety of exercises, the principles, and the movement tactile cueing, the teaching methods, the movement observation. But then what we need is to fill the gap, because we still have these clients coming into us then where we may not have the knowledge or the clinical reasoning skills to be able to help them safely. And that's what I'm here to try to help do. So please feel free to follow me on YouTube. If you want to be a part of our newsletter subscription, just again, ping me. I'm happy to have a call with you to discuss where some of your blocks might be in your current sort of profession and how I might be able to help support you. I'm really, really passionate that Pilates instructors can have an incredible impact on clients' lives when they have the right knowledge and skills. So, okay, and Monica, you're saying you're new to Pilates. Are you teaching Pilates? Oh, good, you're a former dancer. Yeah. Yeah, Pilates can be just amazing for people that have lumbar spine conditions. As you probably know, if you're a Pilates teacher and you've been on this call or you're watching the video, there's no doubt that you have not seen someone with back condition. So Pilates, figuring out intentional Pilates exercises for the type of back condition and or sciatica symptoms that you have can be really incredibly healing and effective. So I've been doing the Pilates work since I had my first injury as a former ballet dancer when I was about 12 years old. So a really long time. Yeah. Okay, no problem, Monica. Yeah, the call's for teachers, but that's okay. I think the key is finding, for you, I think, a Pilates instructor that understands what lumbar spine stenosis is. And so that's what my goal is to train Pilates instructors so that they can say, hey, I've been trained to work with clients that have lumbar stenosis. Otherwise, it can become a little bit of an educational guessing game. Yeah. Thanks so much for being here. I hope I'm not missing anyone's comments. But again, message me. I'd love to hear from you, and I'd love to support you in any way I can. I hope you guys all have a great day.